Hi friends, today we will tell you about Acne Vulgaris. In Hindi, they are known as muhase. And this is the normal structure of skin. You see epidermis. Generally, we are showing here pilosebaceous unit. And this is known as the hair follicle. Hair follicle, here you see a sebaceous gland with erector pili muscle and apocrine gland and acrine gland. From here, the follicular opening, you see a hair shaft is arising, and this sebaceous gland, above that is the epidermis, and here you see the subcutaneous fat, and whatever you see is here is dermis. So what happens due to the high activity of sebaceous gland, the sebaceous material comes out and starts accumulating in the follicular opening, which is being accompanied by propionobacterium acnes. This causes the infection. Due to the high activity of sebaceous gland, the sebum accumulates in the follicular opening, which is being accompanied with the propionobacterium acnes, lead to the hypercornification of the follicular opening, which further causes the epithelial disruption. After the epithelial disruption, the material from the follicular content or the discharge which comes out into the dermis, causing the pustule, papules or ductal hypercornification results in the impacted horny cells, which are known as the comedones. Comedones are generally two types, open comedone or closed comedone. The open comedone are known as the blackheads and closed comedones are known as the whiteheads. Generally, the black head, they are non-inflammatory, and white heads lead to the inflammatory lesions of the skin. So the three processes which are leading to acne are increased sebum production, pilosebaceous duct hyperkeratosis, and increased colonization of pilosebaceous apparatus with propionobacterium acnes. So the next treatment will be told you by Dr. Ashutosh.
Dr. Ashutosh Kumar. And as you have seen the pathophysiology of acne, I will be continuing with the treatment of acne. So there are four principles for the treatment of acne. First is to reverse the hypercornification of pilosebaceous duct. Second is to decrease the population of propionobacterium acnes. Third is to decrease the sebaceous gland activities. And fourth one is to decrease the inflammation. So for mild acne, local treatment is adequate, and for more severe cases we go for systemic therapies. So I will be discussing the drugs used in local as well as systemic therapies. So drugs used for local or topical therapies are, first and most important is benzoyl peroxide, which is used in the form of 2.5% to 5%, and it is antibacterial and comedolytic agent which is applied twice daily. The second modality is sulfur and resorcinol, for example sulfur calamine lotion. Third modality is antibiotics like clindamycin, erythromycin and tetracycline. One of the most important modality is tretinoin and adapalene, which is a potent comedolytic agent. Now I will be discussing the drugs used for systemic therapy. First one is antibiotics. Antibiotics used are tetracycline, doxycycline, minocycline and erythromycin. In some cases corticosteroid can be used, and in few cases it has been shown that dapsone is useful. But the most important modalities for systemic therapy is oral retinoids, that is isotretinoin, which is used especially for severe nodulocystic disease, that is also called stage 4 acne, which is unresponsive to other treatment modalities which we have discussed. And in few cases hormones can be used like ethinyl estradiol which is used daily. So this is the treatment modalities of acne. Thank you.